My name is Patrice Littles, and today I will be inserting an NG tube. Before going into the patient's room, I want to check the doctor's orders. When I check the doctor's orders, I'm also going to check for consent because it's an invasive procedure. I also want to check the medical history and make sure that the patient has no history of nasal trauma, nasal surgery, anticoagulation therapy, or coagulopathy. I also want to check for a deviated septum or a history of epistaxis, which is nose bleeding. Once I've done that and the patient is fine, I want to check precautions. Today there are no precautions. I want to gather my materials. For purposes of the video, my materials are already inside of the patient's room. I would wash my hands. It's not working. I would knock on the door and announce myself. Nursing. Once I enter the room, I want to introduce myself to the patient. Hi, my name is Patrice. I'll be your nurse for today, and you are?
Ruby.
Ruby, very nice to meet you. I would check Ruby's name against the medical record. I would also check a second identifier. I would check for any allergies that Ruby may have. I would explain the procedure to Ruby while raising the bed to a comfortable working height. That way I can maintain good body mechanics. Ruby, today we're going to be inserting an NG tube. The tube is going to run from your nose into your stomach. Before beginning the procedure, I want to place Ruby in a sitting position or high Fowler's. I'm also going to before preparing the tube, I want to check Ruby. Again, I'm going to assess more. I'm going to assess for anything that would interfere with me placing the NG tube, or also deviated septum, and everything seems to be fine. I want to measure the tube, so we're going to go from the tip of one nearest to the lobe. And down to the xiphoid process. So once I have that measured, I'm going to mark the tube. And I'm also going to measure the length of the tube because I'll have to document it later. I'm going to provide Ruby with water, which she's not going to drink yet, but I do want to have it available to her. And I'm also going to lubricate the tube with water-soluble lubricant. So once the tube is lubricated, I'm going to ask Ruby to hyperextend her neck. Oh, well, no, actually, before I do that, I also want to check Ruby for gag reflex. So now we're going to ask Ruby to hyperextend her neck. And Ruby, breathe through your mouth. And so I would insert the tube until I begin to feel tension, and I would ask Ruby to lower her chin to her chest and swallow, and you can use the water if needed. And so I will continue to advance the tube until I got to the mark. If at any point Ruby started to experience any respiratory distress, I would immediately remove the tube. But everything seems to be fine. And so once I reach the mark, I want to secure the tube in place. So once the tube is secured, I want to check at the bedside, but I also want to check via X-ray to make sure that the tube has the correct placement. One thing I'm going to do is instill air into the left upper quadrant. It's only a small amount of air, so we'll do 10 milliliters. Once I've done that, I'm also going to draw out some NG fluid and check the pH. And if the tube is properly placed, the pH should fall between 1 and 3. So now that the procedure is over, I want to tell Ruby, well actually Ruby, I'm going to put Ruby back in a comfortable position and explain to Ruby that the discomfort should decrease with time. And I need to let Ruby know, to let a nurse know if the tube ever becomes entangled or if she ever starts to feel any discomfort, if the tube starts to come off, just to let someone know. Also, I need to explain the importance of oral care. I want to make sure that the tube is pinned to Ruby's gown. I want to lower Ruby down, and I also want to leave the call light next to her and raise the side rails. When I document, I want to document the size and the type of tube that I inserted. I want to document the time and the date of the procedure, how well Ruby tolerated the procedure. While in the room, I would have checked her respiratory rate, depth, and rhythm, and so I would document that. I would document if there were any issues with inserting the tube, and that is all. Oh, I would have washed my hands before leaving the room.